Okay, today I'm going to be performing trach care, and I would perform hand hygiene and then knock, enter the patient's room. Hi, my name is Jillian. I'm going to be your student nurse today. Can you verify your first and last name and date of birth for me? And I would double check that, and then I would also be assessing this patient's respiratory rate and depth, as well as the color around his trach site for what I can see right now. And then I would also be making sure that he ate at least 3 hours before this trach care is to be performed. And now I'm going to start with the care. First, I'm going to take this towel and drape it across him to make sure there's no splashing onto the patient or anything like that. And just making sure it covers him. And then I am going to, these are going to be my sterile gloves for the purposes of this procedure. They did not have a package, but then I would open up my tracheostomy care package and take this out to lay my sterile field on. And then I would don sterile gloves and orient myself. And then the other glove going underneath the cuff. And then adjust as needed now that both gloves are on. And now I'm going to remove the old gauze, pre-cut gauze, and discard, and then remove this first pair of gloves, perform hand hygiene according to agency policies. Of course, if the agency requires you to wash your hands, then there would be a hand washing station, but for the purposes of this demonstration, I'm using hand sanitizer. Also, I do understand I would never turn my back on a sterile field, but this is where the hand washing station is for this demonstration. And now I am going to don sterile gloves again, making sure I orient myself before I begin. And then going under the cuff of this glove, adjusting as needed now that both gloves are on. And then I would begin to remove the things from my package, knowing that all pieces of equipment in this package are sterile. And there is another package, there's more sterile gloves in the package. I will set them off to the side for the time being since they are not in a package already. Removing every piece of equipment from the package. Okay, and making sure that that maintains on my sterile field. Now I am going to take the hydrogen peroxide. I would open it if this was an actual patient, but I will pour this into one area of the package and then take normal saline and pour that into the other area of the package. And then I will take gauze and saturate that with normal saline and wring it out and set it off to the side. Do that with 2 to 3 gauze, depending on how many gauze you have in your package. And then you would also take your Q-tips and put those in normal saline, tap them off a little bit and set them off to the side, just to make sure that they are not sopping wet. And then you would come over to the patient and remove their inner cannula. If it was a disposable inner cannula, you would just discard in the trash receptacle. This one is a reusable one, so I'm going to put it in the hydrogen peroxide. And clean it as necessary. And then put it in the normal saline. Clean it as necessary. And then set it off to the side. Then I'm going to take my gauze and begin to clean my pre-saturated gauze, begin to clean around the site, and then discard. And also take my Q-tip and clean around the site and discard. And the other Q-tip. And if there was drainage from the site, I would be assessing that. This patient does not have any drainage. And then I would continue to take the saturated gauze and clean around the site. And discard after done. Just making sure all areas are clean. And discard. Now I'm going to take my dry gauze and pat dry. And discard. You would not want to leave this wet to prevent skin irritation or anything along those lines. And discard. And then now you can put the inner cannula back in now that it is clean and dry. And then now you can move on to replacing the string around the patient's trach to put on a clean string. And I'm going to have another student, for the purposes of this demonstration, to hold the trach in place as I would have if I was in an actual hospital. So I'm going to make sure that it is untied, and then I'm going to take it off, slightly lifting the patient's head without causing any discomfort, and discard of the old tape. And then take the new. And you would tie it, making sure it's secure, and then going underneath the patient's head with the other end of it. And tying it on this side, making sure that it's secure, not too loose and not too tight. And then obviously feeling that it is not too tight on the skin or anything along those lines. And once that is made sure that it is secure and tied properly, the other person can let go of the trach site. And then you would take your pre-cut gauze, making sure that you're not going to cut gauze, because that could leave pieces that could enter into the respiratory tract and cause respiratory distress. And you're going to carefully insert that underneath the trachea, and you would do that with a new pair of sterile gloves. And then after that is done, you can make sure that the patient is comfortable. You would remove this towel and obviously that would be off to the side. And then you would remove your gloves, perform hand hygiene, and pick up the sterile field.